Do you keep your prescription medication in your bathroom medicine chest like so many people do? Well, if that's the case, do you ever consider who else has access to that medicine chest? Your kids, maybe your grandkids, maybe other kids from the neighborhood? Well, you might want to rethink where you're putting your medications, so stay tuned because our guest today has a lot to say about that. Hang tight. Hey, good morning, everyone, and welcome to Scan FYI. Okay, no, you're not seeing something isn't wrong today. There are only 2 squares on the screen. Normally there's 3. Mary Beth, my co-host, could not be with us today, but my guest today is Maria Reverendo. She is the Deputy Chief of Detectives at the Monmouth County Prosecutor's Office. And today, we're actually, first of all, let's just say it's National Poison Prevention Week. And we're shining a light today on problems with keeping your prescription drugs in places that they're accessible by people who shouldn't have them. So Maria, welcome.
Thank you very much, Andrea. So yes, good morning, everyone. My name is Maria Reverendo, and I am the Deputy Chief here at the Monmouth County Prosecutor's Office. And it's an absolute pleasure and an honor to be here with you this morning to talk about a very, very important topic. As everyone knows, the opioid epidemic is just at an alarming rate, and it really is. If I could share with you the statistics that we're seeing here from a law enforcement perspective, it's very scary. And although the segment here today is about poison prevention, we will get into, I believe, Andrea, about the dangers associated with medications and how it does have a very big part of the opioid epidemic that we're dealing with on a national level.
It is all tied together, Maria. You're absolutely right. And our conversation this morning, we're focusing on safe medication storage in your home and proper disposal of unused or expired drugs. So something that we know for a fact is that an awful lot of you out there have not been cleaning out your medications and probably have a lot of expired medications in the house. So how do we store those safely? What's the best thing for us to do? And Maria, what's your thought about that?
So there's a fine line. We all know that medication is a very important part of everyone's life. There are people that, quite frankly, can't live without their medication. So it's important that we keep it safely. And there are certain areas that you absolutely don't want to keep your medication in, and that's areas that are either very humid or very hot. And so,
like a bathroom.
Correct.
Like a bathroom.
So that medicine cabinet that, it's that's what it's called, but that's the last thing that you want to use that medicine cabinet for, is for medication. That's for all of your toothpaste and your toothbrushes and your lotions. Please do not use that at all to maintain your medication. Other people love to keep their medications above their stove or in the cabinets adjacent to their stove. That's another really, really bad area to keep medications. Again, you are compromising the integrity of the medication that you're going to be taking. And that's why I'm here today, is in addition to compromising the integrity of the medication, you're also putting it in areas that are very, very susceptible to getting into the wrong hands, such as children. So everyone obviously has to think about their own environment at home, but it's important to keep these medications in places that are going to be away from the reach of children, or you may have someone coming in to help you, a painter, someone coming in to help you with cleaning, or and those are all different things that you need to think about when finding the appropriate place, a place that works for you so that you have access to your medication, but it's away from folks that shouldn't have it in their own hands.
So the first thing let's mention, Maria, is typically in Monmouth County, SCAN has participated in the drug take-back programs. And this has been a great opportunity for people to just really do a once over spring cleaning of what's in your medicine chest that's expired. And it's a place to bring and safely dispose of drugs. So what will be the situation this year for 2021?
So Andrea, at this point, we are scheduled to have a DEA National Take Back Day, an initiative here in Monmouth County. At this time, it's scheduled for Saturday, April 24th, from 10 a.m. to 2 p.m. Unfortunately, I don't have all of the locations at this time that are going to be available for Operation Take Back. However, I do know that the Monmouth County Police Academy will be a distribution point for the initiative. What I will do, though, is speak to our public information officers and ensure that very critical information is posted on our Facebook page.
Okay,
so please
good.
stay tuned, and we'll definitely work on getting those lists of locations so that all of your viewers can access the appropriate location. I will share with you, though, that there are a number of means for being able to take care of medications when you no longer need to use them, especially, and what we're very concerned about are narcotics. So I wanted to share with you today that, and we're going to be going through some resources that are available to the public in terms of whether or not it's appropriate for you to flush unused or unwanted pills down the toilet or down the sink. Not all medications are, it's not a permissible way to get rid of them using the flushing mechanism.
Right.
There are other ways where you can take your unused pills and, for example, put them in a container with things like used coffee grounds or others. You can take different sorts of garbage and try to mask them so that they're not able to be used by others. But what I have here, and also what I would recommend, is whenever you're putting your prescription bottles in the garbage, make sure that you take a Sharpie and you go over any sort of personal or sensitive information and
Yes.
block it out, so that if it is recovered from your garbage container, individuals that shouldn't have access to this information, it doesn't get into the wrong hands.
That's
so
a good point.
Very careful.
Yeah, good point.
There are products out there that are very, very useful without naming the exact brand names. They're very simple. And essentially what you do is, if you have unused medications, all you have to do is take this packet, you drop the contents of the packet into your prescription bottle, you add some water into the bottle, you shake it, and you throw the whole thing into the garbage. So it's super, super easy. And I know that there are some national retail stores out there that if you do go and purchase narcotics and you ask for a free disposable system, they will absolutely give it to you free of cost. So the next time that you're in your pharmacy and you know that you have medications at home that you want to get rid of and you can't get, for example, you can't get to the National Take Back event, ask them if they have it in their store and if they'd be willing to give you a packet, and perhaps you can take care of the unused medications that way.
That sounds like a terrific way, because again, the drug take back program happens periodically. You might have a need tomorrow to get rid of some used drugs. Yeah.
That's absolutely correct, Andrew.
Excuse me. By the way, I will be, as we always do, we will share contact information for the detective, as well as resources for the National Poison Prevention Center, as far as to find out, is your drug something that how you can dispose of it. There's a lot of resources out there. I'll make sure that I share them with all of our listeners so that you know exactly what to do.
Thank you, Andrea.
You know what I want to ask you? So what do you say to folks who are listening out there? And, you know, I started out, I said, well, if you're keeping your meds in your medicine chest, you have to think about who else has access to that, like your kids and my grandkids. And to the folks who say, oh, you know, not my grandson, not my kids, they wouldn't touch it. I trust them implicitly. What do you want to say to those folks?
Well, I want to I want to tell you that it happens, and it happens every day, and to great families from all walks of life. And I can tell you from a law enforcement perspective that statistics will show that a number of these pills that are out there on the street, 53.1% are either given, bought, or stolen from a friend or a relative. That is very alarming information. When you think about, again, like you said, we're all very trusting, and we have to just be very careful that someone living with an addiction can become very manipulative. It's just unfortunate, but you can't be too careful. You really can't. And again, I stress to you, 53.1% of prescription medicines that we are finding out there were either given, bought, or stolen from a friend or a relative. So to your
That
point,
is a remarkably high number.
it truly is.
To think that came right out of someone's medicine chest. And what are the most frequently, pilfered medications that we need to really look out for in our homes?
Well, there are so many, and I want to just caution everyone that anything that is a painkiller of sorts, right? So you can go to a dentist and you need it. I mean, the medications are needed. So, and there are people that are suffering from pain and truly need the medication. But anything that's, without going into prescription names, I would tell you anything that's a painkiller, just be wary of it, because it can become very highly addictive and lead to other illicit drugs. And we can definitely post those on our website as to what we're finding in terms of in the last year or two, what we're finding as being the most pervasive. But I would just think about it. If it's a painkiller and it has addictive traits associated with it, you want to be extremely careful.
Do you have any advice that you would give to someone who, let's say you had your prescription filled and there were, let's just say 30 pills in there. Now I just had my whole family over for dinner. They went home. I went to take my pill and I found that there was only 2 left in the bottle. I'm sure that's a common scenario. What should somebody do? Would you want people to confront their families? I'm honestly not sure what to say.
Yeah, look, it's a difficult, that's a difficult conversation to have, especially with family, but a necessary one. And I would just caution anyone that, if you're finding that someone's just not acting normally, or you find that they're not their usual self, and displaying some of the characteristics that you would associate with somebody that, may be addicted to anything, whether it's alcohol or prescription medication or illicit drugs. It's a conversation that's necessary. Again, everyone has a different family dynamic, but you don't want to ever, a month later or a few weeks later, thinking to yourself that you wish you would have had a conversation with a loved one. It's not about shaming. This is not about in any way ostracizing a family member. It's about trying to get them the help that they so desperately need.
Would you say in Monmouth County this is a very prevalent problem?
Oh, it most certainly is. It most certainly is. I will tell you, before getting on the call, I wanted to look at the statistics, and I'll just tell you that in 2019, we had over 189 deaths associated with opioids. In 2020, 165. Nationwide in 2019, we had over 70,000 individuals die in the United States from both prescription pills as well as illicit drugs. And if you think about that number in comparison to other sorts of deaths and causes of death, that number is astronomical. That far exceeds folks that die in car accidents, in gun violence, etc. It's definitely it's a horrible epidemic, and it doesn't discriminate in terms of age or sex or creed or religion. It has no barriers, and it's a very important issue that we need to discuss and not pretend it's not happening, and address it as quickly as possible, and try to get the person the help that they so desperately need.
So we don't want to be in denial and think that, well, it'll never happen in my family, because I'm sure every family where it did happen might have said that very same thing.
You're absolutely right, Andrea.
You know, I want to mention something else before I forget. Another reason not to just toss your pills in the trash is because, I mean, not only can little kids get in the trash, but your pets can get in the trash too. And I'm thinking some of these medications could be potentially lethal to your beloved pet. So you want to dispose of things properly. If not the drug take back program, then Maria had some great ideas with that little thing where you put it in there. You got to make sure you ask for it. So there's many options to dispose of drugs correctly. Many places in your homes to store it so it's kind of out of sight, but always has to be convenient for you, obviously,
Correct.
Whoever's living there. But don't ever think it couldn't happen in your family, because it could. It's unfortunately a big problem in this country. So that was our purpose today, to remind everyone it's National Poison Prevention Week. We all have to do our part. We will also put that hotline number up on the screen for everyone. We'll share all of that, because I'm sure every year, and maybe that's the first person you would call is the poison hotline, because you never know. Like if your pet ingested something, if your child ingested something, possibly even if you ingested something, right?
Right, and you do want to call that emergency hotline right away, or dial 911.
Yeah.
Even in the case of overdosing on an opiate, you want to, I don't want to get into a whole other segment about Narcan, but there are things that have to happen very, very quickly to try to reverse the damage that has been done. So I will absolutely make sure that our public information officers post on our Monmouth County Prosecutor's Office Facebook page any of the locations that are going to be participating in the National Take Back initiative, so that it's out there for all of your viewers.
That will be excellent. Thank you very much. So let's say a very special thank you to our guest today, Maria Reverendo, Deputy Chief of Detectives at the Monmouth County Prosecutor's Office. Again, we're highlighting the fact that it's National Poison Prevention Week. We all have to do our part. You know what? I always say, call 911 first, ask your questions, and do your blaming later. Take care of the problem immediately. All right, remember everyone, if it's important to you, it's important to us. I'm Andrea Tarr, and we will see you next time on Scan FYI. Bye everyone.
Bye everyone. Thank you so much.